During a quiet night at home while reading, have you ever experienced sweatiness, sudden chest pain, and even difficulty breathing at times? Are you self-conscious because one leg is grossly bigger than the other? Do these symptoms make you feel sad, frustrated, scared, and even alone?
If so, we understand. Those days of having TBTs are over, because we have the product just for you. Come with me, and we're going to change your life.
Introducing SCDs! SCDs are the super soft, luxurious sleeves that help keep those pesky DVTs at bay. They are pearly white, so they keep you looking good and feeling good as blood starts flowing while you just lay there. They go on easy and connect in just a few simple steps. First, connect the tubing. Plug it in. And attach the electronic pump and turn it on, and you're on your way.
Now, let's listen to Dr. Lizzie to see how she uses SCDs in everyday practice.
Hi, I'm Dr. Lizzie. I'm a new resident here at the hospital, and I don't know much, but one thing I do know is that I am a huge proponent of SCDs, and no patient gets one in this hospital without my order. SCDs are made up of an electronic controller that pushes air through the hoses into sleeves that encompass the patient's legs. SCDs consist of compartments that sequentially fill with air, applying pressure to the legs using a patented pumping action, and theoretically helping to mobilize venous blood through the body. Some of the patients that I might order SCDs for include smokers, dehydrated patients, those with endothelial damage from trauma or surgery, venous stasis occurring with increasing age, prolonged immobility due to injury or illness, non-active lifestyle, obesity, altered coagulation from cancer, pregnancy, septicemia, and family or personal history of stroke, DVT, or pulmonary embolism.
Thanks, Dr. Lizzie. Now, let's call Blair, an RN on Unit A, to see what nurses think of SCDs.
Phone call for Nurse Blair, line 2.
Hello, this is Nurse Blair. Hi, Mike. I was waiting for you to call. Yeah, I'm a nurse over here at Unit A. Man, I can't tell you how much I enjoy those SCDs. On my unit, we take evidence-based practice pretty seriously. DVTs are no joking matter. Not only am I fortunate enough to work on a unit that embraces evidence-based practice, but the hospital I work for also takes a similar stance. As far as the intervention is concerned, I fully support and advocate for the rock-solid reputation. The device is easy to implement, requires minimal training, and does a fabulous job at mimicking our body's natural pumping mechanism. On Unit A, we're lucky to have professional in-services to educate our staff about DVT prophylaxis, including how to operate the SCD controller and implement this intervention appropriately. We also have huge storage rooms that grant us easy access to these machines and the sleeves so we can retrieve them whenever we need them. The only complaint I have is that I wish the patients liked them more. Sometimes it's hard to convince my patients of the SCD effectiveness in preventing DVTs. Sometimes I've had patients refuse the treatment because of complaints of being uncomfortable and too hot.
Not to worry, Blair. We have introduced a new cooling feature to our SCD pump. This feature blows a cool airflow onto the patient's leg to improve comfort and patient satisfaction.
Wow! Thanks, Mike. I'm sure this will help. What a great improvement to an already wonderful therapy. I can't wait to tell my colleagues and patients. Now, I just wish I could order these for my patients myself and not wait for the doctors. That can sometimes be time-consuming. Do you have any suggestions for that?
Haha, no, sorry, I can't help you there. To implement this therapy, you still need a doctor's order. But what I will suggest, Blair, is to continue assessing your patient's risk factors and continue to advocate for this therapy as best you can.
Will do, Mike. Thanks again, and I can't wait to see these improvements.
Thanks, Blair. Now let's listen to Serena, an RN here on Unit B, and see what she thinks of SCDs.
Hey Mike, I'm S. I'm an RN from Unit B. Our nurses love this product. Here on Unit B, we possess a desire to provide the most beneficial care to our patients. In order to provide the most beneficial care possible, we value the underlying importance of evidence-based practice surrounding the management of venous stasis and the prevention of thrombosis. This product has been a huge help in reaching this goal. Like Unit A, we also have a problem with patient compliance. Patients often remove the devices because they find them uncomfortable or too tight. They also remove the devices while using the bathroom or ambulating the halls, and then rarely reapply them without reinforcement from the nurses. The patients dislike that SCDs are hot and cause perspiration, although the newly added cooling feature has made the patients more satisfied with the product. In fact, several of our patients have referred to the SCDs as their own personal masseuse. Overall, the nurses on Unit B are aware of the benefits of the SCD device treatment and have the knowledge to comply with the therapy treatment. By possessing the knowledge, they are able to educate the patients and their families about the mechanical thromboprophylaxis protocol, which in turn increases patient adherence. Unfortunately, Unit B does not utilize a written policy for the use of SCDs. It would be great if we had a unit-based protocol that resembled the national guideline. Any suggestions, Mike?
Thanks, Serena. We just got word that a representative from the National Guideline Clearinghouse is holding a press conference about SCDs. Let's go watch them live.
Hello, I'm a representative from the American College of Chest Physicians. We have just finished our review of Units A and B. We are happy to report that the usage of SCDs on both floors are consistent with our guidelines for DVT prophylaxis. SCDs on each unit are used generally for patients who are immobile, bedridden, confined to the bed, unable to ambulate, unable to walk, and of course, those who can't move. The only thing that we found to be different was the fact that both units, in fact, do not have a policy. But that's okay. Nobody's perfect. Our guidelines recommend SCDs not only because they are stylish and futuristic, but because they are an excellent addition to the prophylactic regimen of DVT prevention. So next time you're in the hospital, grab a pair. Strap them on. They could save your life. Thank you. I'm sorry. I cannot take any questions. I'm a very busy man.
The research is in. You've heard it from the experts, including nurses, doctors, and even a representative from the National Guideline Clearinghouse. Call now to reserve your own personal pair of SCDs. They're selling fast. Act now and we will throw in a second pair of knee-length SCDs for no extra charge. But wait, there's even more. Not only will you get an electronic pump and 2 pairs of SCDs, call now and we'll throw in a written policy, yours for no charge at all. This written policy can be used in your own facility to improve professional practice. Crazy, right? What a great deal. So before your DVT leads to this.
Take advantage of this special offer.
Call now!
Suggestions, Mike?